This is not good size.
It's so tiny.
A famous man by the name of Lou Gehrig once said, "For the past 2 weeks you have been reading about the bad break I got, yet today I consider myself the luckiest man on the face of the earth." Lou Gehrig was once a famous baseball player until he was forced early retirement. He was diagnosed with a disease called amyotrophic lateral sclerosis, also known as ALS. He was a very well-known man before and after his diagnosis. He also had a positive attitude, especially after he was diagnosed with the disease. He gave a speech shortly after he found out about his diagnosis, and in closing of the speech he said, "So I close in saying that I might have been given a bad break, but I have got an awful lot to live for." After Lou Gehrig passed away, the disease also became known as Lou Gehrig's disease. ALS is defined as a progressive neurodegenerative disease that affects nerve cells in the brain and the spinal cord. If you were to break down the words amyotrophic lateral sclerosis, you would realize that each part means something different. Amyotrophic comes from the Greek language which means no or negative. Myo refers to the muscle, and trophic means nourishment. All in all, no muscle nourishment. When a muscle has no nourishment, it atrophies or wastes away. Lateral identifies the area in a person's spinal cord where portions of the nerve cell that signal and control the muscles are located. As this area degenerates, it leads to scarring or hardening, also known as sclerosis, in this region. In ALS, the nerve cells waste away or die and can no longer send messages to the muscles. This will eventually lead to all of the symptoms, which I will explain further down. The conditions will slowly worsen until the muscle in the chest area stop working, making it hard or almost impossible for one to breathe on their own. ALS can affect anyone at any time, but men are 20% more likely to be diagnosed by the disease than women are. However, with the increasing age, the incidence of ALS becomes more equal with men and women. Half of the people who get ALS live at least 3 or more years. 20% live for 5 years or more, and up to 10% will live for 10 years or more. 60% of the ones affected by ALS are men, and 93% are Caucasian. Just over 5,600 people in the United States are diagnosed with Lou Gehrig's disease each year, and approximately 30,000 Americans have the disease at the same time. ALS affects every 5 out of 100,000 people worldwide. Most people will get this disease between the ages of 40 to 70, but the most common age is 55. It is also possible to get this disease in your 20s and 30s. Symptoms of ALS are things that a person should know and should be aware of. Some symptoms may be so slight that they are frequently overlooked. The symptoms are muscle weakness in the hands, arms, and legs, which will eventually cause difficulty in climbing and lifting and walking, or weaknesses in the muscles of speech, swallowing, and breathing, which can cause a person to choke easily or can cause drooling or gagging. Their head also may drop due to the weakness in the neck muscles. Twitching and cramping of the muscles, especially those in the hands and the feet, are also common. Another symptom is impairment of the use of the arms and legs. A person also may experience thick speech, which some people call, and difficulty in projecting the voice. In more advanced stages, shortness of breath and difficulty in breathing and swallowing can become a big factor. Voice changes and weight loss are also important things to look for if you feel like you or someone you know may have Lou Gehrig's disease. What exactly causes ALS is still unknown. In about 10% of cases, ALS is caused by a genetic defect. There are no known factors except for having a family member who has hereditary form of the disease. If you do have a family history of Lou Gehrig's disease, you may want to see a genetic counselor. As for running tests to diagnose ALS, this part can be difficult. ALS is a very difficult disease to diagnose. There is no test or procedure to ultimately establish the diagnosis of this disease, but there are some tests you can do. These tests include electrodiagnostic tests including electromyography, also known as EMG, and a nerve conduction velocity, also known as NVC. Blood and urine studies, including high-resolution serum protein electrophoresis, thyroid and parathyroid hormones levels at 24-hour urine collection for heavy metals, spinal tap X-rays, including magnetic resonance imaging, also known as MRI, myelogram of cervical spine, muscles, or nerve biopsy, and through neurological examinations. Other signs to help figure out if a person has ALS is their walk may be stiff or clumsy, reflexes are abnormal, there are increased reflexes at the joints, but there may be a loss of gag reflection. Some patients also have trouble controlling crying or laughing. This is sometimes called emotional incontinence. There are also 3 different types of ALS. Sporadic is one, which is the most common type of this disease. Sporadic means it is usually random and can come at any point in time. This is responsible for 90 to 95% of all cases. Familial is the second type of Lou Gehrig's disease. This type occurs more than once in the family line gauge and accounts for a very small number of the cases in the United States, 5 to 10%. Guamian is an extremely high incidence of Lou Gehrig's disease and was also observed in Guam and the Trust Territories of the Pacific in the 1950s. There is no known cure for ALS. The first drug treatment for the disease is a medicine called Riluzole. What Riluzole does is slows the disease progression and prolongs life. Some treatments to control the symptoms, which are also helpful, are baclofen or diazepam, which would be used to control spasticity that interferes with daily activities and can prescribe for people with problems swallowing their own saliva. Physical therapy, rehabilitation, use of braces or a wheelchair or other orthopedic measures may be needed to maximize muscle function and general health. Choking is common. Patients decide to have a tube placed into their stomach or feeding. When this happens, this is called a gastrostomy. A nutritionist is very important. Patients with ALS tend to lose weight. The illness of itself increases the need for food and calories. At the same time, problems with swallowing make it hard to eat enough. Breathing devices include machines that are used only at night, and constant mechanical ventilation is also an option. Patients should discuss their wishes regarding artificial ventilation with their families and doctors. Although there is no known cure yet, there is research that is being done. The National Institute of Neurological Disorders and Stroke, part of the National Institute of Health, is a federal government's leading supporter of biomedical research on ALS. The goal of this research are to find the causes of ALS, understand the mechanism involved in the progression of the disease, and develop effective treatment. Hopefully, through all this study and research, a cure will be in the near future. Another thing that is a good option if you are diagnosed with the disease would be to go to support groups. Emotional support is vital in coping with the disorder because mental functioning is not affected. Groups such as the ALS Association may be available to help people who are coping with the disorder. Support for people who are caring for someone with ALS is also available and may be helpful. Some facts you should know about Lou Gehrig's disease is that it is responsible for nearly 2 deaths per 100,000 populations annually. It occurs throughout the world in no racial, ethnic, or socioeconomic boundaries. Another important fact is that ALS is not contagious. This is a disease that can strike anyone at any point throughout their lifetime, and when it does, it strikes to kill. If you or a family member has ALS, learn as much as you can about the disease and how to take care of it. How much treatment you want for the problem caused by ALS is a personal choice that only you and your loved ones can make. Your values, wants, and needs are important things to think about as you make your choices about your care.
A little bit more.